So what is an EKG?
It's electrocardiogram, so it measures the heart and pulse.
Exactly. So it's not showing the mechanical action of my heart, just the electrical.
Mm-hmm.
So it's an electrocardiogram. I don't know why it's not called ECG, but whatever.
It's some different language.
Yeah. So it's electrical of my heart, and so patients in the hospital can wear what's called a telemetry unit. Have you dealt with those yet in clinical?
Mm-mm.
Okay. It's just this little box that they can put like in their gown pocket, and it has 5 leads that are on them. And so that's just like constantly showing their EKG to a tele-monitor person that watches it in the hospital. Or, so this is for like around the clock. Around the clock. That's how you see around the clock. But they can also do what's called a 12-lead EKG. But this wouldn't be like put on the patient constantly. It's just for like a one-time, like the doctor will order a 12-lead EKG because it's more thorough than the telemetry unit, but it's kind of expensive.
Mm-hmm.
And they have to put 12 leads on the patient, so that, and the lab will just come up and do that for a couple minutes and get a reading on their patient. But I don't think you need to focus too much on the 12 lead. I just want you to be aware that it is available.
Mm-hmm.
Usually you're just going to be dealing with your telemetry units as a student nurse. But what do we want to teach our patients? So let's say you go into the room and they're like, the doctor just ordered an EKG for me, and they don't know what it is. What are you going to teach the patient?
We just talk about this, what it is, that it's going to measure the electrical pulses of your heart, so
Mm-hmm.
making sure that your heart is pumping like it should.
Yeah. Make sure that my SA node, my AV node, all that stuff is firing like it should. Also that it's painless.
Mm-hmm.
It's pretty non-invasive.
Mm-hmm.
So besides having to maybe reach under their gown and stick some leads on them, it's pretty non-invasive. Yeah, but mainly you just want to teach them that it's painless, it won't take that long, and that it's going to give the doctor an idea of maybe what's going on with their heart.